Good morning, ladies and gentlemen. First of all, I would like to thank the organizer to invite me to give this presentation. The title of my presentation is The Purine Metabolite Inosine Monophosphate Accelerates Myelopoiesis and Acute Pancreatitis Progression. This picture gives an overview of HIPCs and their lineages. On the way to terminally differentiated cells, hepatic stem cell goes through the primary stem cell stage, multilineage progenitor cell stage, committed progenitor cell stage, and terminally differentiated cells. In multilineage progenitor cells, the common myeloid progenitor cells gave rise to granulocyte monocyte progenitors, namely GMP, which further gave rise to granulocyte and monocyte. In the setting of hyperkalemia, we and other groups have shown that a deficiency of lipoprotein receptors such as ABCA1, ABCG1, SRB1 impaired glucose efflux, leading to HIPC proliferation and inflammatory cell production and plaque progression. We further showed that circulating HIPC frequencies was positively associated with coronary stenosis severity in patients with coronary heart disease. In CHD patients, they were all performed cardiac angiography to assess coronary stenosis, as you see the severe stenosis here. And HIPC frequency was assessed by FACS analysis. By multivariate logistic regression analysis, we found that the CRP, white blood cell count, HIPC, neutrophils, and LDL cholesterol levels were all positively associated with coronary stenosis severity in CHD patients. In type 2 diabetes, the patients are featured with hypoglycemia and insulin resistance. However, the chronic inflammation, dyslipidemia, and the metabolic disorders and the needs contribute substantially to vascular complications and mortality. Among all vascular complications, acute pancreatitis (AP) is the most severe one. In the prospective study and the meta-analysis study, we all show that the incidence of having AP were approximately 1.5-fold higher in type 2 diabetic patients compared with non-diabetic patients. Furthermore, diabetic patients were associated with higher increased risk of severe AP, such as getting intensive care admission and organ failure. In these type 1 diabetic animal studies and transient glycemia studies, authors have shown that hypoglycemia acts through neutrophils to release IS-800A8 and A9, which act on GMP cells to promote GMP cell proliferation and myelopoiesis, resulting in inflammatory myeloid cell production and atherosclerotic lesion progression. Therefore, we address two questions. First, any other metabolites rather than glucose that result from the altered metabolic states in type 2 diabetes could modulate the proliferation of myeloid progenitor cells. And second, how the metabolite-induced myelopoiesis impacts on inflammation and AP, acute pancreatitis. To investigate that, obese type 2 diabetic mice were used in the study. Type DB mice develop hypoglycemia at the age of 12 weeks. As you see, at the age of 24 weeks, mice shown increased fasting blood glucose and impaired glucose tolerance. The plasma level of cholesterol and triglyceride were similar between two groups. When we look at the white blood cell count, mice at the age of 24 weeks old, white blood cell numbers were higher compared with 8 weeks. Moreover, the number of neutrophils were more pronouncedly increased at the age of 24 weeks old mice. When we injected 8 weeks or 24 weeks old BMCs to currently induced AP mice model in the mice, injection of 24 weeks diabetic BMCs promoted more higher severity of acute pancreatitis, as you see the increased lipase activity, amylase activity, the HE staining for total cirrhotic score, as you see the damage, and inflammation, as you see the number of NPO cells infiltrating in the lesion. By FACS analysis, the HSPC frequencies were comparable between two groups, but the CMP, the common myeloid progenitor cell frequency, was higher in 24 weeks old DB mice. Moreover, the frequency of GMP cells were also increased or higher in 24 weeks old mice. To evaluate the proliferative status of these cells, BRDU were injected peritoneally in the mice. By FACS analysis, you see on the right, the number of BRDU incorporating GMPs was much higher in 24 weeks old mice, indicating increased proliferation in GMP cells. Let's give the representative FACS plot for BRDU analysis when gated on GMP cells. You see the BRDU positive cells here. These slides provide you representative FACS plots of GMP analysis in the bone marrow cells. First, we gated on living cells, then lineage-negative cells, and then CK positive, SCAM positive cells. Finally, the GMP cells, CMP cells, and NEP cells. Thereafter, GMP cells were sorted out by FACS for targeted metabolomics. By analysis, 7 metabolites were identified increased in GMP of type DB mice at 24 weeks old. Of 7 metabolites, 3 were within the de novo pure nucleotide biosynthesis pathway. They were ribose 5-phosphate, which initiated the pathway, IMP inosine monophosphate, which is a cool intermediator of the pathway, and GTP, guanosine triphosphate. By mass spectrometry, we further confirmed the enriched purine metabolites in bone marrow niche of diabetic mice at 24 weeks old. So the diabetic mice were also featured with elevated purine metabolism. In vitro, when we added AMP or GTP to cultured lineage-negative cells, the HIPC frequency and the number did not differ among the group. However, AMP treatment, though dependently, increased the number of GMP cells. By contrast, GTP treatment has no effect on GTP cell proliferation. By FACS staining, we further confirmed AMP treatment stimulated BRDU the proliferation in lineage-negative cells and GTP cells, as evidenced by the number of BRDU incorporating cells in the entire population. When cells were cultured for 5 days, FACS analysis further showed AMP treatment increased granulocyte production at the end. By FACS analysis, we showed inosine monophosphate treatment enhanced CK turnover, this transient turnover in GMP cells. It also stimulated X6 phosphorylation in lineage-negative cells and GMP cells. X6 phosphorylation is the mediator of cell proliferation. By Western blot, we showed AMP treatment increased mitochondrial transcription in lineage negative cells. As you see, the mitochondrial transcription marker, mitochondrial TFA, and IF1 were all increased in AMP cells, AMP-treated cells. APISS is an enzyme that mediates catabolization of AMP to AMP. In ADS heterozygote mice that we established, they displayed disrupted purine metabolism, and in these mice, the GMP cells were much higher compared with the control. When BMCs were treated with AMP for 3 days, AMP treatment further resulted in a more pronounced GMP cell production in heterozygote BMCs compared with a wild-type cell treated with AMP. We further identified an indirect modulation of GMP proliferation by AMP. By FACS analysis and Western blot, we showed AMP stimulated AKT phosphorylation. In vitro, AMP treatment increased GMP cell production in bone marrow cells, but which was aggregated by the addition of AKT inhibitor. However, all these effects were attenuated by the addition of AKT inhibitor. As you see, the last group here. Finally, we explored the association of purine metabolite and inflammatory cells in diabetic patients with or without acute pancreatitis. In the study, we recruited 50 type 2 diabetic patients and 31 type 2 diabetic patients with acute pancreatitis. By non-targeted metabolomics, 4 metabolites were found increased in patients with acute pancreatitis. 2 of them were purine metabolites. They were succinyladenosine and 2-deoxy-guanosine monophosphate. They were oppositely associated with granulocyte proportion in blood. Production contributes substantially to acute pancreatitis. Finally, I would like to thank my students and my collaborators from China and Leuven University. Thank you for your attention.